Hi, I am Dr. Raghav, consultant, cataract, cornea and refractive surgical sciences at Center for Sight, New Delhi. Today I'll be talking about refractive surgery. Refractive surgery, as we know, is now the need of the hour. Before I get into the details, let me talk a brief about refractive surgical sciences. There are two basic types of refractive surgery that we are following. So I'll briefly be talking about both the technologies that we are using right now. One is of course LASIK or laser in situ keratomileusis, and also other technology known as lenticule extraction. So like we know, imagine this is the cornea. In a LASIK, what we do is we fire a laser on the cornea and we make a flap. And then the thickness of the cornea is removed by burning this tissue. And this tissue is then burned. And the flap is placed back. This is LASIK. But again, the improvement in technology is now the lenticule extraction. In lenticule extraction, we don't need to make a flap on the cornea. We make a small incision, this in envelope, we just make a small incision and this lenticule is removed. So today I'll be talking about lenticule extraction. So what this machine is providing is that the laser shots that this machine is giving, they are ultra fast, very short energy and very precise. So the laser beam is focusing on the tissue for a very short duration and a short pulse of energy is given in a really short duration of time. Because of that, we are getting tissue and adhesion-free lenticules or adhesion-free cuts in the cornea. Imagine these are small indentations caused by the IFS or any older generation laser. So of course, once you have to cut this type of paper, it is of course difficult because you have to go towards these big holes and then cutting this is difficult. But in a sense, what the Elita is giving us is very short bursts of energy. And once these short bursts of energy are placed very close together, cutting the tissue is like butter. So very well and very aptly named silk, smooth incision lenticule keratomileusis. Once we have these laser shots positioned very close to each other, cutting the tissue becomes a piece of cake. This translates onto the cornea and we have very smooth flaps. The flaps can be dissected very smoothly in a single swipe, of course, because of the pattern in which the laser is cutting. And of course, in silk, the lenticules are made very, very smooth. They are almost free-floating. The best part is that the wound or the entry wound of this machine, we are having 10 cuts. Since it is biconvex, so the edges are of course very close together and we can find the anterior and the posterior plane very, very easily. And once you are inside the anterior and posterior plane respectively, yes, cutting the lenticule or dissecting is very, very easy. I would say within 30 to 35 seconds, the lenticule is out, and the lesser the time you spend in the cornea, better the post-op results. Till now, we have done a number of cases on this machine. With the silk procedure, patients are very, very happy. More than 95% patients had 20 by 20 vision at 1 month, and more than 90% patients very confidently said that they would recommend this to friends or family. And none of the patients, I would say a very small proportion rather, had issues at night. Majorly more than 90% were very comfortable driving at night. So I'm really looking forward to you all also trying this technology. Again, living up to its name, very smooth and very good results. Thank you.
Follow Planet LASIK and post your queries to get answers from the experts.